On behalf of Breast Cancer Ireland and to mark World Cancer Day, we would like to say a big thank you to all our supporters and friends, to our scientists and clinicians who are working tirelessly in research, to our outreach coordinators who are spreading the word, educating and raising awareness on the importance of good breast health amongst women of all ages, and to you, the general public, without whose support we could not progress our research vision, which is to transform breast cancer from often being a fatal disease with 680 deaths annually to a treatable illness long term. Some really exciting developments are taking place. We have invested in clinical trials, and there's an international clinical trial taking place at the moment where 21 of our patients with a particular form of breast cancer have been given a dual therapy of both Herceptin and a new drug called Apatinib, and we have seen 50% of their tumours eradicated completely. In addition, with sophisticated blood tests that are now available, we are able to provide each patient that's diagnosed with their own personalised and tailored treatment plan. We look at the risk of recurrence, and we can also see which patients will benefit most with chemotherapy as their preferred treatment option. Our survival rates are also improving. We've seen an increase from 75% to 82%, and this is as a direct result of our screening that is available through BreastCheck, but also, more importantly, the increased education and awareness that is driving good breast health. In the last 2 years, we have seen our mortality rates fall by 2%, which means that we are actually achieving what we've set out to do, which is transforming this disease from often being fatal to being a treatable long-term illness. A recent investment by Breast Cancer Ireland saw the introduction of a new state-of-the-art intraoperative radiotherapy device, which we donated to Beaumont Hospital. It's the first machine of its kind to come to the country, and it allows for a certain cohort of patients to be administered radiotherapy while they are actually having their surgical procedure conducted. This eliminates the need for them to return to the hospital every day for 5 consecutive weeks for radiotherapy, and means that they can go home to begin their road to recovery. Speed of research discovery is paramount, and Breast Cancer Ireland's investment in specialist breast research nurses who have been recruited for the designated cancer centres throughout the country and who are collaborating, collecting all of the tissue and serum samples for everybody to access, has seen a dramatic increase in the amount of research publications that are going ahead and going towards clinical trial for the ultimate benefit of the patient, with new treatments and new therapies being produced. It's thanks to the support of the general public that we are able to change the landscape of research for patients that are diagnosed with breast cancer. Their support is definitely making a difference. So a sincere thank you from everybody at Breast Cancer Ireland.